Hello, my name's Angela from Angela Simpson Functional Medicine Physiotherapy. Thanks for clicking on this part of the website titled Hormone Imbalances. And this is an important area for females to address. Often these symptoms will be coming up at various points in the lifespan. I will often be addressing hormone imbalances in the timelines between the ages of around 30 and 55 years old. And this isn't to say that I won't help women on either side of this spectrum, but this tends to be the area age-wise where these symptoms are most common. So this is an area age-wise that I have decided to focus on more. And the reason for this is because often the hormones will start to fluctuate and change in this time period, and sometimes they will become out of balance. And the way they typically become out of balance is the estrogen levels are higher relative to the progesterone levels. And for these women, they will be symptomatic in several different ways, often related to their cycles. If they're still cycling, they will be having some mood changes, which is really common, especially if the progesterone levels, for example, are too low, or the estrogen levels are too high at certain points in the cycle. Sometimes women will also experience depression and anxiety, which is also just a common result of the hormones not being balanced. They're fluctuating too much, or potentially they're just too high or too low in general. Some of them will report even weight gain within the time period of their cycle, or possibly weight gain as they're getting closer to menopause. And this can often be related to hormone imbalances as well. And sometimes women will report pelvic pain as well. So sometimes women will have pain at different points in their cycle. Pre-ovulation and pre-period are most common, but they can happen throughout the cycle at various different times, depending on when and where those hormones are out of balance. And to look at hormone imbalances and treat them, typically you want to look not just at the hormones themselves, but you want to look at why the hormones are out of balance. And so often there is some testing that needs to be done to look at the hormones themselves and look at what pathways those hormones are being utilized on. The hormones, when you're premenopausal, should be being produced primarily in the ovaries and secondarily in the adrenal glands. And sometimes if the adrenal glands are a little bit out of balance, this is also the pathway where the stress hormones are produced and utilized, cortisol as well as some other hormones. And so if these hormones are slightly out of balance, they will also affect the hormone health. So this is important to look at as well. But even looking further back than this, often when the adrenals are not producing properly or the ovaries are either under or overproducing, we want to be looking at other systems in the body. So we want to be looking often at overall inflammation in the body, overall ability to detoxify on a daily basis, as well as overall health and nutrition. And if there is any potential that there is some blocks in the system somewhere along the way that aren't allowing these hormones to cycle and produce and be utilized properly. And so this does require what is called the systemized approach, where you're looking at a timeline and a history all the way back potentially from when you were a child, and figuring out why the hormones have potentially swung out of balance for where you're at in your life cycle now. And often involves treating, like I said, not just the hormones themselves, but often involves treating several other systems in the body to get the hormones balanced again. And so if you're interested in learning more about this, please let me know. You can contact me for a free 45-minute consult to talk about your hormone health or potentially some other health issues that you find might be plaguing you today. Thanks for listening.